Hello everyone, myself Dr. Aditya Gupta. Let's begin our another third video in the NEET PG recall session with first aid. Again highlighting the importance of this book. The book, which I believe is the diamond standard as far as the preparation for examination is considered. Move over your metallic standards of silver, platinum and whatever it is. This is an excellent review and revision book. If you do this book, and you can do this book in the last 1 week, you will get maximum questions, especially as far as the first and second prop is correct. And let's start. So they had asked a question about diarrhea, steatorrhea, and HLA-DQ2. So basically, they were simply asking you about celiac disease, which diet should be avoided. Given here in first aid in a very easy term, that the patient presents with autoimmune. It's an autoimmune intolerance of gliadin, gluten. That is causes malabsorption and steatorrhea. Malabsorption will result in what? Diarrhea. So diarrhea and steatorrhea. And here it is written in first aid that it is associated with HLA-DQ2 and DQ8. So next time they can ask you about DQ8 as well, or they can easily ask you which HLA is associated with celiac disease if they want to ask a one-liner. And answer will be HLA-DQ2. Okay, and then it gives you the treatment. Treatment is a gluten-free diet. So basically anything that has gluten, that should be avoided. So wheat should be avoided, barley should be avoided, and products which contain wheat or products which contain gluten should be avoided. Next question was, a patient with TB is on ATT, anti-tubercular therapy, and then he has tingling sensation. What is the vitamin deficiency that is the cause of this? So here in first aid, vitamin deficiency is given excellently. In my opinion, vitamins should always be done from first aid. They are given best. So this is my own first aid. See here. So vitamin B6, they have very easily written that its deficiency causes peripheral neuropathy. Deficiency of vitamin B6 causes peripheral neuropathy, and this peripheral neuropathy will then cause a tingling sensation. Inducible by isoniazid and oral contraceptive. So its deficiency is induced by isoniazid. Isoniazid is a part of anti-tubercular therapy, ATT. So again, another question given directly picked up from lines of first aid, that ATT means isoniazid. Isoniazid will induce deficiency of vitamin B6, which will cause tingling sensation or peripheral neuropathy. Next question was, they had given you this image. Right? And this image is nothing but white hot spots caused by vitamin A deficiency. Again, really emphasizing why first aid is really good for vitamins. In fact, this image is that of pellagra deficiency and the castle neck appearance that occurs. This was asked in the last year NEET PG. So it doesn't matter which NEET PG it is, be it last year, be it this year, and I'm pretty sure be it the next year. First aid will have you covered. Next is meninges. So meninges, cerebrospinal fluid meningitis में क्या होता है? Again given in a very tabular form, easily in first aid, so that you are able to revise that bacterial में PMNs यानी न्यूट्रोफिल्स होंगे, प्रोटीन एंड ग्लूकोज, प्रोटीन बढ़ा होगा, ग्लूकोज कम होगा. वाइल फंगल या टीबी होगा तो ऑल्दो प्रोटीन भी बढ़ा होगा, ग्लूकोज कम होगा, बट सेल टाइप जो होगा लिम्फोसाइट्स होगा. सो आई थिंक इन द क्वेश्चन दे हैड आस्क्ड अबाउट lymphocytes with protein increase and sugar decrease, and the answer obviously in such a scenario would be tubercular meningitis. Then there were two questions from this table of first aid. क्वाइट लिटरली सिंपली एक टेबल से एक क्वेश्चन ही दो क्वेश्चन भी आ जाते हैं, एक पन्नों से दो क्वेश्चन आ जाते हैं. एंड वन ऑफ द प्रीवियस वीडियो हैड हाइलाइटेड हाउ अ सिंगल पेज गिव यू आंसर टू 5 क्वेश्चंस. Now this is the question that they had. They had given you this image of a macrophage with crumpled tissue appearance, and they had asked you which enzyme is deficient. So answer would be Gaucher disease, and the enzyme that would be deficient would be glucocerebrosidase. In another question, they had given a scenario of lysosomal storage disorder and given you cherry red spot with hepatosplenomegaly, and the answer would be Tay-Sachs disease in that particular scenario. Then they had asked you about Warburg effect, and what does Warburg effect do? Warburg effect is nothing but cancer cells utilizing glycolysis more rather than aerobic production of ATP. And this is given in first aid. Warburg effect is shift of glucose metabolism away from mitochondrial to glycolysis in order to preserve the carbon for synthesis of cellular structure. So they have given you the reason as well. They have given you what Warburg effect is. In the hallmarks of cancer, they have given all this. Then they had asked you which protein is involved in DNA folding. The answer is histone. Again, given very easily, DNA extends in condensed chromatin and they loop around the positively charged histone. So the folding and looping around जो है वो histones के around है. Answer would be histone. They ask you कि telomerase का aging के साथ क्या होता है. Here it is given very clearly easily. Upregulated in cancer, telomere increases in cancer and decreases in aging and progeria. So telomere increases in cancer, decreases in aging. They asked you what happens in aging, and answer will be decreases in aging. Then they have given you Sampton's triad, nasal polyp plus asthma, which drug to avoid. Here it is given in first aid, aspirin के ऊपर it is लिखा हुआ है adverse effects में it's given in adverse effects that allergic reaction, especially in patients with asthma or nasal polyps. That is what Sampton triads is. And आस्थमा में भी लिखा हुआ है दैट इट इज एनसेड एक्साजर्बेटेड. तो अगर आस्थमा है तो एनसेड एक्साजर्बेट होगा, तो एस्पिरिन ऑप्शन में सिर्फ अकेला एनसेड था, तो उसको अवॉइड करना चाहिए था. देन दे हैड आस्क्ड दैट अ फीमेल इज गिवन हैज यूटीआई, इज गिवन अ ड्रग एंड दिस ड्रग कैन नॉट बी गिवन इनटू अ चाइल्ड. विच ड्रग इज इट? सो आंसर इज फ्लोरोक्विनोन. ऑफ्लॉक्सिसिन था उसमें आई थिंक ऑप्शन. सो आंसर वुड बी ऑफ्लॉक्सिसिन. व्हाई? एंड यहाँ पे देखो इतने आसानी से फ्लोरोक्विनोन को पूरा एक्सप्लेन करते हुए फर्स्ट एड में दिया हुआ है. क्लिनिकल यूज़ क्या होता है? क्लिनिकली किस में यूज़ करते हैं? ग्राम नेगेटिव रॉड्स ऑफ यूरिनरी ट्रैक्ट. तो यूटीआई में हम लोग यूज़ करते हैं. एंड एडवर्स इफेक्ट्स में क्या लिखा हुआ है? कॉन्ट्रा इंडिकेटेड इन चिल्ड्रन लेस देन 18 ईयर्स ओल्ड बिकॉज ऑफ लंग डैमेज टू द कार्टिलेज. एंड फिर निमोनिक्स भी दिए हुए हैं. फ्लोरोक्विनोन्स बोन्स, तो डैमेज करता है कार्टिलेज को. So this is how first aid has given a lot of MCQs from first aid directly picked up from lines of in first aid. I think covered close to 40 to 50 MCQs by now, and I think more than 100 MCQs, 80 to at least 100 MCQs were actually from first aid. Or if you had added just annotated first aid just a bit like this, I have annotated my first aid, you would easily, if you were able to revise this book, this is the good Ratta Maro, don't do the bad Ratta Maro. Understood? This is what I've been trying to tell everyone, that this is a good revision resource. Instead of focusing on the endless notes which you cannot revise, focus on first. Thank you and have a nice day. Rattamar.